Thank you, Speaker, for the opportunity to speak to this. When we spoke yesterday for 10 minutes, we talked about all of the various rating agencies and the various organizations who are very critical, Speaker, of the Government of Ontario's financial position. In fact, I spoke yesterday about the Chamber of Commerce document entitled, "How Bad Is It?" When you get a document entitled, "How Bad Is It?" you must presume, Speaker, it's pretty bad. The Canadian Federation of Independent Business weighed in, the Bank of Canada weighed in, Conference Board of Canada, all of these organizations have talked about how this government's numbers are simply wrong. But no organization hit home even more than the government themselves did, Speaker. Only 4 months after passing their budget, they had to come back to the legislature and confess that they were off by $500 million. Speaker, in 4 months, their budget was off by $500 million. So what I wanted to talk about today is the consequences of debt and deficit here in Ontario, Speaker. The fact that there's a bill here that wants to go forward, but let's talk about the consequences of not being able to balance your budget. I'm going to talk specifically at first about my hometown of North Bay, my riding of Nipissing. I'm going to quote from a couple of our local newspaper articles where Nipissing University had some layoffs this year. In fact, President Mike DeGagne said round one of the layoffs affecting the administrative side of the university, they let 16 people at Nipissing University go, Speaker, because this government can't balance their budget. When you wonder about debt and deficit, those aren't very sexy topics, but debt and deficit have very real consequences in each and every one of our homes. So to these 16 people at Nipissing University, who, and I know all of them, one of them was there, just got her 25-year pin. She's now home. That was followed by round two at the university. It's 22 professors at Nipissing University are now gone. 22 professors gone. So here we go, Speaker, with a total of 38 people at Nipissing University gone. This is one university in my hometown. Let me talk a little bit about the hospital, the frontline workers who are now gone from the North Bay Regional Health Centre. So here they are, and let's talk about, this is all very recent, Speaker, the 94 full-time staff at our North Bay Regional Health Centre who are gone. 54 RPNs, Speaker. 54 nurses, 2 pharmacy techs, 4 secretarial staff, 2 health record typists, 1 material management aide, 8 ward clerks, 2 operating room attendants, 9 distribution attendants, 3 environmental services attendants, 1 support services worker, 1 linen worker, 1 hairdresser. So, Speaker, there's no hairdresser left for the long-term psychiatric patients. 1 payroll assistant, 1 switchboard operator, 1 buyer, and 1 accounts payable clerk. 94 full-time staff are gone from our hospital, Speaker. Now, there's also 34 part-time staff who are gone. Over 100 men and women are gone, 14 RPNs, 13 public support workers, 2 pharmacy techs, 2 MDRD techs, a support services worker, another hairdresser, and a secretary. Speaker, that's just in North Bay, where we've now got 128 fewer people, frontline healthcare workers, who are no longer working at North Bay Regional Health Centre. But it just didn't hit my riding of North Bay, Speaker. The fact is The cuts are happening in Ontario's hospitals right across the province, and they're devastating. These are front-line healthcare workers. The depths of the cuts at this point is truly shocking. In New Liskeard, in the late fall, it was made public that the operating room would be closed 50% of the time, and 18,000 hours per year of nursing care were cut. In Timmins, the hospital is cutting 26 of its remaining beds. That's 16%, or 1 in every 6 beds in Timmins Hospital cut, as well as physio and 40 staff positions. We're talking frontline care workers here, Speaker. In the Sioux, 50 hospital beds, 12,500 hours of nursing care in December. Wow. All the remaining, Speaker, we heard that at the pre-budget consultations. In December, all of the remaining beds in Penetanguishene Hospital were cut and closed. This is what's happening under this Liberal government because they don't know how to balance a checkbook. They don't know how to control their debt and deficit. They say one thing, but they do the other, Speaker. We've heard it through the gas plant scandal. We heard it in the Mars fiasco. We heard it in the Orange debacle. We're hearing it in the Sudbury bribery scandal. They say one thing and do the other. They said there would be no changes, and Speaker, in Georgian Bay General Hospital, which is the amalgamation of Penetanguishene and Midland, 36 complex continuing care, rehab, and palliative beds were cut. That's 30% of the remaining hospital beds, or 1/3, being closed down, despite the fact that those hospitals were already at 100% capacity. Sounds a lot like my town of North Bay, Speaker, where this brand new hospital, we're shutting 60 beds. That's because the Liberal government cannot balance their budget. These are the consequences in the day-to-day lives of people by cutting frontline health care. In December, a unit at the Charlotte Eleanor Engelhart Hospital in Petrolia was closed down. In the fall, the Huron-Perth Healthcare Alliance, that's Stratford, Seaforth, Clinton, and St. Mary's, closed 17 beds across the alliance. Recently, we heard the member from Quinte talking about the devastating cuts at Quinte Health Centre. They lost 58 full-time and part-time RNs. Now, these are not only cuts. These aren't the only cuts, Speaker. These are only the cuts that have been announced in the last couple of months, the last 2 or 3 months, Speaker. That's what we're hearing because this government cannot balance their budget. In the last year, the Scarborough Hospital made public its plans to close 20 surgical beds, 2 operating rooms, thousands of surgeries, outpatient clinics, and tens of thousands of nursing hours. Major cuts, Speaker, are coming. I know they don't like to hear the facts. Member from Newmarket Aurora, come to order. I know the facts hurt, Speaker, but they're going to hear them. The cuts at Winchester District Memorial Hospital. Cuts happened all across Renfrew, from Newmarket Aurora, Perth, second time. Smith Falls, Arnprior, all across southeastern Ontario. In addition, the Wingham Hospital has also faced major cuts. Speaker, this list can literally go on and on. I know in North Bay, the Near North District School Board had 8 people that they let go, and here we go. Here we go. 60 beds closed in that hospital. 60 beds. My mother was in that hospital 2 weeks ago in the aisle for 12 hours waiting to get a room because these clowns are closing 60 beds. Speaker, this is enough. I can't take any more from these guys.